an exciting webinar. So we will go through a few things, but before we get started, we wanted to just share who we are and say welcome. So I'm Dr. Lena DiGenova from McGill University.
Thank you, Lena.
And I have my colleague on the line, Dr. Tayab Rashid, who's also co-chair, University of Toronto. Okay, hi. Can everyone hear okay? Okay, sounds great. So we promised an interactive webinar, and to get us started, we're going to start with a few polls, and we are also going to have an opportunity to use the chat features. So we wanted to start today with getting a sense of what part of the country you're joining us from. So Haley will help us out a little bit with the polling feature here today. Haley? And so on your screen, you will see a new poll. And so we have what part of the country are you joining us from? Eastern Canada, Ontario, Quebec, the Prairies, Western Canada, or the Territories. Okay, we'll just take another minute or so to tally the results. Okay, great. So looks like we have lots of folks joining us today from Ontario and Quebec. We also have equal participation from Eastern Canada and the Prairies. And we have, oh, look at that, from Western Canada we have 18%. So thanks everyone for participating in that poll. So today we are going to be talking a little bit about an exciting website that Tayab has been really instrumental in working on, the Caucus Campus Mental Health website. And we're also going to follow up on a discussion about mental health training. We talked at our last conference call in March about perhaps coming together and working on an inventory. And so we're going to talk a little bit about this inventory for peer supporters as well as for staff. Now, but before we get started on the fuller discussion today, we have a second poll for you. We promised it would be interactive. And the second poll is about your role in campus mental health. Because we have a large community. Our community is over 550 members, and it's really inspiring and interesting to hear and learn from you all. And we wanted to get a sense from you today who is on the line with us. So Haley will showcase our next poll, which is a little bit about your role in campus mental health. So let us know if you are a counseling or mental health director, a health or counseling director, a counseling/mental health associate director, a counselor, manager, dean or associate dean, or student. And once again, we'll have a minute or so. Oh, I see that to tally the results. Looks like there might have been a challenge with some of the submit buttons here. Okay, so I see some folks also typing into the chat function. Thank you. Okay. See, there's lots of great activity here. Great, so we see that there are some wonderful titles popping up here. We have pretty much almost everyone represented except for deans and health or counseling, associate directors in counseling or health. That's great. Thanks, everyone. And we also have our health promotion team. Great. Okay, so I will, Tayab, if you're still there on the line, we wanted to hand it over to you to get started on taking a look at the website.
Thank you, Lena. My name is Tayab Rashid, and I have been with the Campus Mental Health Community Practice for a couple of years, and this is my last year. And I just wanted to sort of summarize some of the work that we have done in the last 5 years. Most of you will be familiar with this, what we popularly call Wi-Fi diagram. And this diagram starts with the first three areas about mental health which impacts all students on your campus. Um, so, from a lens of systemic practice, the first three areas are relatively lighter blue, lighter green, represent all students, and then the next two students with some concerns, or may not be having some stellar coping skills, and the last two areas are the darker greens are students with mental health concerns. So this Wi-Fi diagram goes from the top to institutional structure, organizational planning and policy, and right bottom into crisis management. And it covers the whole gamut of a systemic approach. Now, this approach was a result of a national working group which began in around 2011, and at the annual conference of caucus in Montreal 2013, caucus in association with Canadian Association, CMHA, Canadian Mental Health Association, launched the post-secondary student mental health guide to systemic approach, which in short we call a guide. So it was a PDF, was very well received in 2012 and 2013. Next thing what we found from our members of our campus mental health community, they wanted to know what to do with this. So next year, after giving people some time to, browse through it, to familiarize, we conducted a national survey that are you using the guide, or what are the next step for optimal use might be. And overwhelmingly, we had about close to 60 post-secondary institutes from all around the country participated in a brief survey, and they said, this is wonderful, a very nice document. It addresses lots of issues on our campus and campuses which we are familiar in our province. But we want to see how we can translate these areas into more concrete steps which are actions which are connected to outcomes. So as a result, just brief history. As a result, we our community of practice then took it on to translate the guide into an interactive inventory where people can ascertain where they are on these 7 different areas, and how to distill the 7 different areas into more concrete, measurable actions. So now I'm going to take you to the website. So if, bear with me, share my screen and share. And here, I hope everyone can see. Lena, can you see my screen?
I sure can. Thanks, Tayeb.
So this is the website that, with the help of funds from Caucus, we created. This is the sort of a companion or an extension of the guide. Let me give you a brief tour. We don't have time to give you the complete tour, the brief tour of the website. So if you go to the top is the menu where home and then in about is a bit of introduction. What model we are using, a systemic approach, and then a most important thing is about inventory, which I'll come in a minute. And then the inventory is also, you can click there and you can go to it. I will just walk you through down, so you can just scroll down, and easier way is to just click the first area, which is institutional structure, organization, planning, and policy. One of the areas which applies to everyone. And then you have all the other areas. These are all clickable. So if you even click at this crisis management, you will go to that. So let's try somewhere in the between. Mental health awareness. So if I click that, it brings me to all these areas, and I can go to here to mental health awareness. And the details, you can learn a little bit more about mental health awareness. Let's say you don't want to necessarily assess take the inventory, you just want to learn about it. So what we'll do is let me see why this is popping in. Okay, back to something.
The website is somewhere there.
Yes, how about that?
There you go. There you're back.
So,
Great.
so let's start mental health awareness and where we were. And then you click on the details. You can learn a little bit more about this specific area. And let's dive right into the start inventory. Okay, so first there's a brief consent that we are not collecting any identifiable data, and even if we ever want to do our community practice or caucus want to do some trends, the data will be pooled. And if you agree to that, let's say agree, and I will be directed to inventory. So there's an explanation of the three bands, which I'll tell you. Each of the 7 area we operationalized into, turned into 10 sub areas or 10 items or questions, let's say. And this one is mental health and academics. So let me read the question and then I'll explain the bands to you. How aware is the faculty on your campus that students with mental health issues have concentration difficulties, higher test anxiety, lower academic efficacy, and poor time management? This is a lot of loaded question. Now, keep in mind, we kept the questions, we extracted the question from the guide. We just to remain faithful to the guide, the work which was done, which was produced by Suiting, Cheryl Washburn, and Johnny Morris in 2013. We did not want to deviate from the original guide because we thought maybe let's stick with the guide as it is and extract the items from it, and maybe at later stage we can change if we need to be. So even sometimes the questions have multiple constructs. They are actual items or points distilled or written in the guide. So for this question, if you have if your faculty is very well aware, you have choices for 3. You can the highest level of awareness would be 9. Maybe in the first band, maybe a little bit low would be 8 or 7. So that's explained up here: the first band, second band, and the third band. And then lots of people will have I'm not sure because this is not my expertise. So you can certainly select that. And for some say this my answer is not captured, and you always want to there's something else might be a possibility. So if you click other, a text box will open and you can type your answer, and it's a limited number of characters that are allowed. So for the sake of just demonstration, I'll pick somewhere in the middle for this item, and as soon as you select that item, it you see this green tick box that it is done. Mental health embedded in syllabi, and how well is the importance of mental health embedded in course and etc. So you can read the question. If it's very well embedded, again, 3 bands, somewhat moderately, I'm going to select again a bit of a moderate answer here. And stigma and prejudice. So let's say for this one, I say I'm not sure, just for the sake of experimentation, accessible mental health information, and this one I'll say other. Um, let's say my answer is this. This is not relevant to me. So you can put or any kind of answers. What kind of mental health initiatives? Your campus is taking a number of mental health initiatives. You can select that answer. Culturally competent services. Does your campus offer supportive and culturally competent mental health services to international students? This is a very specific one. And let's say here, and accommodations. Fairly well developed in most of our campuses. Mental health initiatives. Does your campus evaluate the effectiveness of mental health initiatives? You can select that. And then engagement and awareness campaign, this. And then the last one will be active outreach. How much outreach? Now you have all 10s. So if you miss any, even if you submit, that item will be highlighted that you have missed it. So I will submit the item, and here you go. You get there's a little bit intro about how the feedback is organized. The top bar, which is the orange bar, is your campus profile. And if you go towards the bottom, the profile ranges from 0 to I believe it's 8. I believe my screen is not capturing. I think. Let me see. 7 or 8. So and then there is the sort of a grayish bar is your provincial. Because we collected the information from which province you belong to in the beginning, and you didn't see the page because I had already logged in. And then what's the Canadian average score? So then you can see where your campus is in, and then if you just hold it for a cursor for a bit, you can actually the pop-up box will come with the score. So this gives you sort of a quantitative view of this particular area, which about mental health awareness. Now and then you can go down and see more of a table where you can see your campus profiles is 5, your provincial average is 5, and across Canada is 5.2. Now that's just the assessment, but because we wanted to give you more resources as well, so if you click on this mental health and academics, you will come to for each of our items we came at we look at the scan the literature as wide as we could, and then came up with recommendations. We got a lot of input from our COP. So these are some of the recommendations that in case you want to increase mental health and relationship between mental health and academics, these are recommendations. But then we didn't just stop at recommendations, we also added at least 3. So in this case we have more than 3 potential outcomes. In terms of putting outcomes, we were very cognizant not to put a lengthy assessment, more naturalistic, more easily collectible data. For example, tracking the number of students referred by faculty to various student support services. that's something that can be done, which is already done in some campuses, or it's done in some services but not in others. So these are sort of measurables, concrete measurables, and then you can see for number 2 all the items for each items. And for example, there's tons of recommendations for stigma and prejudice, and you can see outcome as well. So I'll skip to go towards the end, and then you have the option to continue to the next area, or you can print. You just want to assess your campus mental health, this particular facet of your campus mental health. You can hit the print button, and you can then print, and you can print as open it as a PDF view, and you can save it as a PDF view as well. So because we don't save data, so you can print it, and then you want to take it again after a while to see if the scores have changed. So you can do that as well. So let me go back to, so this is one area. You can also provide feedback. So it is connected to a Google feedback doc, and you see, some of the items I'm not clear, I wasn't sure. So because this is this project is sort of in a dynamic, we want it to be not static, and we want to update it. So your feedback is very important. So you can provide feedback as well. You can, as I said, you can print as well. So let me go back to inventory and tell you.
Yes, I'd love to see one of my favorite parts of the website
go
tab.
to this one, and if you don't want to take inventory, you can still get the recommendations and outcomes, because some people don't want to do the assessment. You can still you can bypass the inventory, and then in the interest of time, I'll just quickly skip to the last pieces. This is best practices, or let's say promises practices, and we have here we have listed a number of practices. For example, wellness instruction program at Rochester Institute of Technology, and then put a URL. So you click, and you can go to in this particular area, you can go to see an illustration. We tried our best to use a framework to define best practice. There is none in our field that what defines a best practice. I would caution you, maybe these are promising practices. So then you have a couple of other examples. Then if you open this accordion sort of menu, then you have, for each of the area, we looked at the published literature, and then summarized at least 3 papers with full references. And we tried to put the papers which were more recent. So when we launched this website about a year ago, so the publications are around 2011-12, unless it's a seminal article and quite old, we had included, but we had tried our best to keep more recent publications. And these are not just the abstracts; these are sort of gist of the article, and then 3 readings you will get, but you will also have references to further readings as well. After the research, you have 3 videos embedded. So this is a Jack project, Stigma, and they've done some wonderful work. I'm not gonna play it, but these are taken from credible source. These videos are taken from credible sources, not anyone who just put a video on YouTube. Jack project is one of the biggest NGO doing some work around stigma, around mental health. So then you have a couple of other videos as well. So this, in a nutshell, you get if you, and this is all free. There is thank you to Caucus for providing us some seed funding, but it was a result of wonderful work of our COP members and a number of volunteers. So from, let me just give you, you have recommendations and outcomes, you have best practices, you have relevant research, and you have relevant videos. Uh, for this is for one area, but these are available for all 7 areas. So this is a very quick tour, Lena, of our website. As I am saying goodbye to the co-chairman ship of this COP, I'm hoping this work will grow and will advance, and it will help us or inform us in in establishing some benchmarks, some standards, especially the measurable ones, in terms of tackling the what I can say is almost an epidemic of mental health issues on post-secondary campuses.
That's wonderful. Thank you, Tayab. When McGill was developing its health and wellness strategy, I know I personally referred to this page many, many times because it had a lot of really interesting research and practices, as you mentioned, either promising or best practices in one spot. And I found it helpful to be able to refer back to one location and then, for example, point my colleagues to it and have really meaningful discussions with the
Oh,
tool.
thank
So
you.
thank you
It's
for all
not
your
my
work
work.
on this.
It's work of our COP and some wonderful folks. I'm just one voice representing work of so many dedicated individuals. So proceeding on.
Absolutely. So I wanted to hear from the participants today. How do you envision using a tool like this, or have you used a tool like this on your campus? And we can certainly use the chat feature to engage with this question. Okay, so we're seeing lots of entries coming in. There's always an exciting part of running a webinar when you have these pieces. Okay, so we have from AM, additional evidence / printout as evidence to require change with senior management.
So,
okay. Yes, so it's a great way to engage in some meaningful dialogue with senior management on your campuses for sure. Now, Tayab, do you see any future developments for this website as we wait for more
my hope is that our
to
first edition was to remain very faithful to the guide, but in doing so, some of our items have multiple constructs. We also want it to be, not too long, not too short. So 10 questions, 10 items per area, so 70 items. And you don't have to do the entire one. You just want to do the accessible mental health services or policies or mental health awareness. What I would like going forward is to hear feedback from our national stakeholders audience in whatever way you are using it, and say, this item is probably outdated now because the guide was issued in 2013, and the landscape of mental health in Canada, as most of you are aware, has changed. So I think it's important to keep things updated. Research needs to be updated. Lots of tons of interesting articles have also came. Um, so I think we need as a sort of a sort of a focal point where we can decide, okay, maybe after 1 or 2 years we can update certain parts of the inventory and add more resources.
Yes, absolutely. That's really great. I am just taking a look at the chat feature, and there's some really great dialogue coming in. I just wanted to mention, for example, Jason, who talked about using the inventory for focus groups with stakeholders and conducting gap analysis for webinar wellness strategy. I think that is a fantastic way to use the tool. We also had some discussion from AM about our key performance indicators and how the tool was helpful in, or can be helpful perhaps in tracking changes over time, which is something that you mentioned, Tayab, as well, in terms of taking the inventory multiple times so that you don't have, because your campus changes, and it would be great to sort of measure progress over time. We also have some really interesting commentary about viable options for exploration and implementing different changes on campus, and to increase trust and leadership in the recommendations, because we have this research all in one place. Thank you, Heather, for your comments. Okay. And there's also just one last comment I wanted to talk about in terms of using the guide and developing meaningful programming from Crystal Valentine, and using this as a way so that even people who are not specifically involved in the program development can certainly engage in campus mental health support work. So thank you all for your comments and feedback. Now, Tayab, did you have any other questions for our participants today about the website as we move forward into the
My
pre-conference
only
session that we have coming
request,
up at
it's not a
Caucus,
question, is
and
take the
some other work
inventory
for
and
the
even
COP?
if you want to take one section and provide feedback, because I believe in there's no, the collective wisdom of our professionals is much, much more powerful and much more effective in bringing the change. So if you take it, and you will not offend me, this is a national work. So if you even criticize work, that's all well and good. So please take it and suggest, and hopefully next co-chairs, or we can find some other resources, because the funding is ever so tightening, to update it based on your feedback. That's it.
That's wonderful. Thank you. And of course, if you have any, for our participants, if you have any suggestions or would like to talk to us about the website, please feel free to do so. As Hayab mentioned, there's a feedback feature. There is, of course, a contact feature as well. You can connect with us through the website, and we'd be happy to talk about any of your thoughts about the website. So thank you. Now, if we're all ready, I think that we'd like to move on to the next portion of the call today, which is really about following up on a discussion that we had a few weeks back as a community of practice, where we were contacted by the accessibility and as well the peer supporters communities of practice to ask a little bit of, they asked us a little bit about what we're all doing around mental health training. And as Tayab explained, as part of the website, there are tons and tons of work that's being done across the country around building capacity around mental health awareness, building capacity around helping to respond to students' needs and demands. And to do so, we have all been engaging in different forms of training. And one of the one of the questions that the accessibility and the peer supporters communities of practice had for us is, what specifically are we doing? And as a group, we talked a little bit about what should be our next step in engaging in a dialogue around training. And the answer was, how about we start to develop an inventory of our training so that we can really make sense of it and come together and really have a meaningful discussion about next steps. And so as part of that, we specifically wanted to touch base today on two areas. One is for peer supporters, and the second is for staff. So we're going to open up a poll, and I'm not sure if it doesn't work very well. I know there were a few challenges in the last poll that we issued, but we have another question for you all is, what does training at your institution look like with respect to, I'm just going to open up this poll. Here we go. I'm not sure if you all can see it, but what training does your institution offer peer supporters around mental health? Okay. And we're just going to add that in here for a second to get you all to provide some input. Okay. Okay, thank you, Nicole, for your comment. I just put it in this chat feature. It looks like there's some challenges with the polls today, but that's okay. Great. Now here at McGill, we actually have a lot of attention that we're paying to peer support training. We actually are launching a new health and wellness promotion team, and as part of the team we have a peer support manager, and we are interested in looking at certification for peer supporters. We're interested in really supporting our students who have really been on the front line of supporting not only students but in distress, but also working with us to help us improve our service delivery. They really are open and honest about what they're seeing students talk about and bringing it to our attention. So we're really grateful for that. Okay, so I see that there are a few folks who have submitted some responses to the question, which was, what training does your institution offer peer supporters around mental health? And so what we have here from Jason is, thank you, Jason, for being a contributor. We have mental health first aid, CMHA community helpers, assist. I see that quite a little bit on the chat box, which is for suicide intervention. We also have Safe Talk. There are also conversations here about it's scrolling so quickly, it's quite something. We also have conversations here about child and welfare. Oh, sorry, there's QPR. And there's also a question here, have you looked at Ottawa's Community Support Network online peer support module training developed with Child and Welfare Research Group? This is why I love our community. I always learn new things, so thank you, AM. Okay. So we also have a one-day training for different student groups like tutors, mentors, student assistants. And I think there's lots of also conversations across the country around including not only conversations around peer supports, but also referrals to help our student peer helpers to work with that. And of course, self-care, confidentiality, and
I see lots of universities are doing assist training, mental about especially with the peers, accessibility is coming, health promotion. I see. So it's quite a gamut of services.
Mm-hmm. That's great. It is, and I'm just curious to learn more about what is included in things like general orientation or training, because I know on a lot of campuses, and when we were having this discussion a few weeks back, there were conversations about, for example, including a training around active listening, and of course supports and referrals. So getting students who sometimes are in unpaid positions because they are volunteer roles to participate in training can be sometimes a little bit challenging. But so many students are involved in peer support. It's fantastic. And in fact, one of my colleagues recently pointed me to the new jack.org website, which has phenomenal new website on supporting youth and peers. And if you haven't had the opportunity to take a look at it, I definitely encourage you to do so. It has been it's just a wonderful website, and it's just really well presented. Okay, so we have a few minutes left in the webinar, so we just wanted to ask you the second part of the question, which I will post here in the chat box right now. And that is, what training does your institution offer staff around mental health? And this could be anything related to mental health first aid, or even for your clinicians. There's such a wide gamut of skills and training available, and I think that would be helpful to learn more about it. Okay, so we're seeing lots of mental health first aid and assist, safe talk as well.
Lena, might I ask how folks are evaluating the impact of this training? I see first aid, assist, QPR, more feet on the ground. Is there anyone would like to share that they have some way to measure the effectiveness of this training either to peers or to staff?
That is a great question. I'd love to learn more. I see there's a lot of in-house training as well for staff. I know here at McGill we definitely have some of that, and we also have some speakers who are coming in to talk to us about
and likewise, our health
first
promotion professional Elsa is on this webinar. She does tons of training with the peers and also with the staff, especially with assist. So I think it looks like that across country we have quite a diverse range and quite active training programs.
Okay, great. And so it looks like we have some responses to your question, Tayab. So we have, thank you, Patty, for your contributions from UBC. So we have some work out of UBC that's been working on a mental health first aid impact assessment, and unfortunately the results will be shared soon. We also have some comment from Mira, thank you, around Jennifer Massey's work a few years about the mental health first aid training that was done over at Queens. And an interesting comment as well around the simple measurements, which I'm always intrigued by, which is the number or ratio of staff who complete or attend the training. Absolutely, that is a really important indicator to keep our eyes and ears open for as we move towards the spirit of the systemic approach that is presented in the guide in supporting all students. Okay. So in the last, as I know there's some more comments coming in, so we have a comment here from Jason, thank you, around assessment and wanting to do a little bit more assessment and doing some surveys as well. At McGill, we launched our health and wellness strategy report about a year ago, and in our student mental health action plan, we do have some indicators that we're looking at. And for us, education, specifically around building capacity to support students and around mental health, will include attendance numbers as well as the impact of our training, looking at some of the outcomes around success and how folks are feeling in terms of not only how comfortable they are in supporting students, but also looking at some incidents as well. And thank you, Mira, for posting the link to the article from Jennifer Massey a few years back. Thank you very much. Okay. So in terms of the last few minutes of our call, we just wanted to mention that we will be following up a little bit later. We have an insert survey link. We will be following up later this week with a survey to learn a little bit more about our training for peer supporters and for staff. It's a very short questionnaire, but I think it will go a long way in terms of helping us to build that inventory that we talked about a few weeks back. And last but not least, we also wanted to invite you all to join us at caucus. Tayab and I and Michael from the Counseling COP will be hosting a community meeting, which is going to be held on Tuesday, June 18th from 4:45 to 5:45. And we're very excited because we want to hopefully present some results from this survey, but also take the opportunity to share what we've learned so far at caucus because it's going to be the first time that we have a mental health stream that we are extremely excited about. The mental health stream has been something that we worked very closely with a number of colleagues across the country, and we are excited to see it come to life.
Yeah, so shameless plug. Lena and I and Michael, we are doing a half-day pre-conference, which focused on a little bit of inventory, the more technicality of it we can show, but also fostering a dialogue that how can we measure, evaluate the wholesomeness of our mental health issues, not rather only from, let's say, a policy perspective, not only from accessibility perspective or not from crisis perspective, but as a holistic approach, because I don't think so mental health is only the responsibility of counseling center. It is a campus-wide responsibility. It's a shared responsibility. So using this tool as a systemic approach, we plan to do a pre-conference, and there's plenty of ways we will involve you because we will ask you lots of questions using a different format and hopefully it will work. So that is on a Sunday from 9 to 12 before caucus.
Yes, thank you. And we'd love to, if you have any questions for us, please feel free to send us questions through the chat feature. We do have a few more minutes before we sign off. And one of the things I'm really looking forward to at caucus this year is just the variety of different conversations around mental health that, as I mentioned earlier, are across the systemic approach. I'm just really looking forward to seeing all of those pieces come in and having really interesting conversations with colleagues across the country. And thanks to everyone for sharing all of these wonderful links that you have been sharing with our colleagues. We will be circulating these links so that everyone has access to them. And I believe that the presentation is already being circulated, but if not, we're happy to do
So
so.
before we end, any questions? We don't promise that we will have the best answers, but we will try. Is it possible to access? So there's a question, is it possible to access the chat commentary after a webinar in written form? Lena, I believe that is possible, but we'll confirm from caucus administrator, yes.
Yes, absolutely. And if anyone has some comments or some questions that they would like to discuss at the community meeting, please feel free to reach out to us. We have our emails here on the next page. Please feel free to reach out to us, and we're happy to include that in the agenda for our in-person meeting. We also will be following up in the future to talk specifically about international student mental health and some of the topics that came up at the last community of practice discussion at our conference call, which included a conversation about not only embedded models but satellite counseling and
let
what
me
that looks like.
also
So
just
we're going
as
to be putting
take an
those
opportunity
two
to,
together.
as Lena already alluded to that, this is the first time Caucus has instituted various streams, and our COP has worked actively with our colleagues. So please check out the mental health stream. Some wonderful presentations have been placed and they'll be presented. So if you are looking for some innovative and applied ways of tackling mental health, look for programs, presentations, short and longer ones under mental health stream. Our colleague from Sandra Yoon from downtown campus, University of Toronto, has been done a wonderful work in this regard.
That's a great idea. Thank you. Okay. Well, thank you everyone for your time. And as I said, looking forward to seeing you at caucus and looking forward to our continued discussions of the community of practice. Have a great